exception of when your eyes are closed and when you're going to sleep. That's when you see the two big changes. That's a good question. So I mentioned neuromodulation in the title of my talk. This is what it means, basically. It's inducing neuroplasticity. And you guys may have heard of neuroplasticity, but it's essentially changes in the brain. For a long time, neuroscientists didn't believe that adults' brains could change. They thought it was only kids that the brain would change, but they were fixed after a certain age. They've come to realize with new experiments now that your brain can change throughout your life, and it's called neuroplasticity. And there's different ways to change your neuroplasticity. You can do electrical stimulation, magnetic stimulation, you can use sound, you can use medications, pharmacological, and there's lots of different ways to change the neurological activity and the connections within the brain. But these are some of the most popular here. Select SSRIs you've heard of, they're antidepressants essentially. Well, what was interesting about this is they assumed that depression was a lack of serotonin in the brain, a lack of these neurotransmitters. So they would give these SSRIs, and immediately the SSRIs would increase serotonin levels in the brain, but they weren't seeing a decrease in depression right away. It would take weeks in order for the depression, if it worked at all, in order for the depression to lift. So they started studying this, like, why does this happen? Why can the serotonin levels increase dramatically right away within a few hours to a day, but then you don't see the results for a few weeks? It was because it was actually the SSRIs were changing the brain neuroplastically. New connections were being formed, and you were seeing actual physical and structural changes within the brain and new connections. So that's what neuromodulation or neuroplasticity includes there. Deep brain stimulation, this is a picture of it right there. They go in and do surgery, open up your brain, and put these stimulators in there. It's pretty invasive. And then you may have heard of vagal nerve stimulation. It's used a lot with epilepsy. Basically what they do is they stimulate the vagal nerve. They implant it here in the chest and stimulate the left vagal nerve. And it can be very effective at reducing epilepsy. However, it also is very invasive. And there are other ways to stimulate the vagal nerve without cutting somebody open, very effective ways to do that. So that's what neuromodulation is. It really changes the activity in the brain, and that's what I look to do. So if something's too high, I want to bring it down. If something's too low, I want to bring it up. That's neuromodulation. Okay? Does that make sense? Any questions on that? Okay. So the history of electrical stimulation of the brain. The ancient Egyptians used to use these catfish that would put out 350 volts, and they used to essentially shock people, right, to treat nervous system diseases. Roman doctor used to use torpedo fish. So this is an electric catfish. This is a torpedo fish with 220 volts. If you got anybody here electrician? Anybody? I know you do some. Is that a lot of volts go through the body? Yeah. So they would actually like stand in water. They would put these torpedo fish. Yeah, they would do it in shallow water, and they would essentially electrocute themselves in order to treat some of these certain neurological ailments. And then some Muslim doctors also treated epilepsy doing the same thing, but they would actually place it directly on the person's head and shock them. Yeah, and that's 350 volts. Yeah, that's pretty powerful.
Did it work?
Well, yeah, actually, it did. It did. There was some effectiveness to it. If they didn't die, it did. It could. So yeah, if you survived it, it certainly could work. And they did it because they believed back then, evil spirits and stuff like that. So, and I won't comment on that. But well, if you guys has anybody here seen the movie One Flew Over the Cuckoo's Nest, right? This is, you guys recognize Jack Nicholson here getting the electroconvulsive therapy, right? So it's burned into my memory when I first saw this. So it was used very prominently in the 1930s, especially in the insane asylums, right? They would use it for bipolar, schizophrenia, depression. The individuals were fully conscious, and the side effects were significant. People would break their bones, right? Because the contractions were so strong, the muscles contracted so hard, they would literally break bones. They would get headaches, obviously. That's one of the least problematic things that happened. Post-traumatic stress disorder. That was a major trauma, so people were getting PTSD. And then major memory loss, so they would have long-term memory issues and loss after this. It did, in some cases, help with some of these issues, but some of the side effects, were significant. In 2011, FDA classified it as the highest risk, but they approved it for depression. So it's still approved, it's still being used right now for depression. It's very different today than it was back in One Flew Over the Cuckoo's Nest. So they'll put people under general anesthesia and they'll give them muscle relaxants so they don't break their bones, essentially. But there's still pretty significant side effects. Memory loss and headaches are very, very common, especially long-term memory loss.
So they still do it, but they put them to sleep.
They do. They put them to sleep, and they basically turn off the muscles, so you don't see these big violent reactions, except in the foot. So what they'll do is they want to watch the foot, and so oftentimes they'll just not put the muscle relaxants to the foot. However they do it, I believe they do some kind of cuff. But they can watch the foot and watch it contract, but the rest of the body is relatively calm, Yeah. This is Tiana, you might recognize her. So today, what we're able to do is we're actually able to do current, or I'm able to do current, called transcranial direct or alternating current stimulation. And it's a much gentler way to stimulate the brain with current. You're not going to see these violent, you don't have to put the individual to sleep, there's no pain with it. The only one side effect, or the one thing that some people do notice is some tingling sensation around the area where the current is going through, depending on where I put it. On her, I'm actually using a couple points here on the frontal lobes, but sometimes it's put at the mastoid and other areas of the brain. But that's a pretty common, in many people, get that tingling sensation. Fatigue can occur, and headaches are, a small percentage of people, and then nausea can occur too. So those are all very, very temporary, nothing like the long-term major issues with the electroconvulsive therapy. So emerging research is showing it's very effective for many, many neurological issues, anxiety, depression, autism, you can go down the list there. But it's a very, very new technology, so there's not a whole lot of research yet. A lot of it's coming out of the clinics and clinical research, and there's a lot more research on TDCS versus TACS. Direct current versus alternating current. And I'm not going to, I'm not an electrical engineer, and most of you aren't either, so I'm not going to go into the difference between them. But there's a lot of emerging research on that, but it's still a relatively new technology, and there's not a lot of doctors that have this technology, although it's been around for quite some time. Actually, it's concerning. Some gamers now are buying their own units. These I guess they're making them. They're very, very creative, and they're hooking up batteries to different electrodes and stuff. And gamers are using them to enhance gaming and enhance their brain function, because it can enhance function and it can enhance, focus and all these different things. It does concern me though, especially when you're using it on a neurotypical individual with a developing brain. So, there's not a lot of research yet, and so who knows about the long-term potential effects on that individual. They may get good benefits on one end, but you may see detriments on the other end, so you got to be very careful. There's always a risk-benefit to everything, right? So I think for sure the benefit has been shown to be pretty good for most of these neurological disorders over the potential risks that I've been seeing, but it is relatively new technology. So not a lot of doctors are using this yet.
How long do they go into the treatment? How long is the treatment itself?
Like a session?
Yes, session. Yeah.
Oh, approximately an hour. Yeah, it's about an hour, give or take.
And this is current, so this
It's current, yeah. So it's 30 minutes to an hour, depending on the individual. Sometimes shorter. It really depends on their sensitivity, but it can be up to an hour. Sometimes it's as short as 20 minutes, but it can be up to an hour. And what it does, it sends current directly through the brain, different brain areas. And you can use it on the cortical area, the subcortical, which is lower brain. So there's a lot you can do with the transcranial direct current stuff. Yes?
Is that, does it
create neuroplasticity? You're seeing actual changes in both function and structure of the brain. Yes, so neuroplasticity, so you can see some effects very, very quickly in some people. The reason that occurs is because that's functional neuroplasticity. That means actual connections within the brain are changing very rapidly. The structural stuff, where the actual brain starts to rewire differently, that takes more time. So that's what's called structural neuroplasticity.
Does it continue doing it after you finish doing it? It goes on its own?
It's very stable, yeah. Some of the emerging research is showing.
Half continues?
Yeah, even 2 years later. The longest out that I've seen now is about 2 years, but it's shown that the results are lasting it for at least 2 years.
But what happens after that? The pathways stay there, or they just
Yes, yeah, that's what they've been shown. So it's stable. Once you set those pathways, even after you cease the therapy, up to 2 years so far in the research has been shown that the pathways are stable. Whether it's stable for 5 or 10 years, we don't know.
Yeah.
So
So then possibly you have to do the treatments again down the road?
It's possible you may need tune-ups, which is very common, you know, not necessarily as frequently. So in the beginning when you're doing this therapy, it's like anything. It's more frequent. It's like going to the gym, right? If you're trying to get in shape, you go 3 or 4 or 5 days a week. Once you're in shape, you don't have to go as much in order to keep it like that. But it appears that they're relatively stable, but you may need tune-ups over time. Yeah.
What if there's brain damage, like brain cells, you're dead, you cannot have new paths, that's what I'm interested in.
But you actually,
Imagine.
yeah, but you actually, there's been shown now that adults can actually create new neurons. So it's called neurogenesis. And they didn't believe that adults could actually, there was neurogenesis in adults. It was never believed before. They only thought neurogenesis occurred in kids. Emerging research is showing now that neurogenesis occurs in adults as well, particularly in the hippocampus and the olfactory bulb. The hippocampus is the area where learning and memory. The olfactory bulb has to do with smell. It may occur in other areas, but certainly within those 2 areas, there's a lot of neurogenesis going on throughout our lifetime. Also, you create new pathways. So even if there's big, dead areas in the brain, that you can create different pathways. The brain can actually reorganize, and so you can create new pathways, which is pretty cool. Yeah, and that's the neuroplasticity. So you have neurogenesis creating new brain cells, neuroplasticity creating new pathways.
And I do believe in that because my daughter actually had, dark holes. And because she had a very creative ballet and constantly doing ice skating and very athletic, 25 years old. Once she started taking psychotropics, it burnt, and it was like lace, actually like lace, like very delicate wiring.
Yeah.
And then when she started taking psychotropics and they kept testing, one didn't work, there's another one wrong.
Yeah.
About 25, I said, okay, I'm going to UCLA, we've got to find out what's going on.
Right.
And what happened is that it burned the ones that she had built because of her activity.
Yeah.
And she lost a lot of motor, absolutely large and small motor movements. But, so what you're saying is you could reroute those?
It could be rerouted. Yeah, the brain is amazing. Yeah,
I know
the
it
brain
is. That's
is
why I'm so
incredible.
interested
Yeah, so
in
the brain can rewire itself with help. Sometimes it can do it by itself. Other times it needs help, and that's right.
I would imagine, like in this case, yeah.
Yeah, certainly. And if you guys look at the research behind a lot of the medications given to individuals with neurological disorders, really the only one that has a lot of efficacy behind it are the psychotropics or the antipsychotics. The other ones don't really have a lot of good research behind them. The problem with the psychotropics and the antipsychotics is there are a lot of adverse effects potentially with them.
The damage.
Yeah, there's a lot of risk for that. So yeah, certainly.
Would you mention how many times that treatment is?
It depends on the individual, but we go very frequent in the beginning, depending on the individual, but it's usually, yeah, it's like 3 times a week. Oftentimes, that's what I start most people on, until we get real good long-lasting changes and then taper them off.
They could be from weeks or months?
Yeah, weeks or to months. Neuroplasticity, functional neuroplasticity occurs within oftentimes weeks, but structural neuroplasticity often takes months, sometimes years. So for long-term changes, especially with somebody that has long-standing problems in the brain, it can take 1 to 3 years to get really good structural changes in there. But oftentimes you can see results sooner than that, but oftentimes it takes a while because their premorbid history, meaning that they didn't have good brain function necessarily, most of them, until a certain age, and then suddenly they went downhill. Usually there were problems early on, and then they just, over time, potentially got worse or they stabilized. A lot of times, a lot of the emergent research now on autism, you hear parents talking about regressive autism versus the ones that happen very early on. They're doing prospective studies now looking forward, and they're finding that even these kids that they call regressive were having issues early on that may have not been noticed by the parents or the doctors. Motor delays, certain verbal delays, certain subtle things that are happening that they're noticing, certain eye tracking problems. And the parents thought, yeah, they're doing well, and then they suddenly regressed at 2 or 3 or 4 years old. Actually, when you look at it, the problem may have started sooner, and they were more vulnerable to particular insult. So they're doing really well, they get their MMR shot, and they regress, right? That was the trigger for major regression, but potentially there was some underlying issues there before that just made them more vulnerable to that stimulation.
How much is Coach Perez?